Let's talk about gas gangrene in this class. This is another important surgical infection which is considered quite lethal one. Means if it is not treated in time, then death can occur rapidly, and a lot of complications are associated with this. But before we go and discuss gas gangrene, we should know a bit about gangrene. What is the meaning of this term? What are the different types? What are the causes? And how do we manage? Okay, let's talk generally about gangrene and then move on to the specific type of gangrene, that is gas gangrene. Let's move on. Now, all of you, uh, look here. This is not a new thing for you at all, because from the discussion of pathology, okay, we have been talking about gangrene. Now, gangrene develops when there is abrupt loss of blood supply to a particular tissue. Okay, so when a body tissue die because of lack of blood supply, some secondary changes occur there, and that is called gangrene. You can also say, okay, putrefaction occurring after the ischemic necrosis of certain tissue, and that is called gangrene. So ischemic necrosis occurs first. Ischemic necrosis means death of the cell or tissue because of lack of blood supply, and putrefaction is secondary change which occurs there. Both these conditions need to be together to call it gangrene. See that gangrene can occur because of underlying illness, injury, or infection which has to cause decreased blood supply. So different causes are there. Fingers, toes, and limbs are the most commonly affected area for gangrene. We all know that. Look at this picture here. Okay, here, let me use the pointer. See this. Okay, this is the foot area. These are the toes. Okay, this is great toe. Okay, and then the other toes. Now see, look at this black discoloration, and it looks quite dry type of gangrene. So this is a typical picture of the gangrene. So death of the tissue because of ischemia along with some secondary changes called as putrefaction. So fingers, toes, and limbs are most commonly affected, but gangrene can occur inside the body also. Like inner organs can also suffer from gangrene. During pathology discussion, we have talked about that, like intestinal gangrene, okay, gallbladder gangrene. The different things, different terms which you can use to inner part of the body as well. Now see here, when blood cannot travel freely throughout the body, then there is death of the tissue resulting in gangrene. So these are the common causes of gangrene: diabetes, atherosclerosis because of any other causes, and even peripheral arterial disease. Now diabetes can lead to gangrene because of atherosclerosis, because atherosclerosis has so many different risk factors. Diabetes is one of the important one. So atherosclerosis can lead to decrease in blood flow to particular area, okay, that can easily result in gangrene. Another important cause is there. Diabetes is immunodeficiency condition, so infections are quite common in diabetes, and any infection, okay, can result in decreased blood supply to that particular area, and again can result in gangrene. So the combination of factors are there in diabetes. Now, atherosclerosis, I already told you so many other risk factors like smoking, hyperlipidemia, hypertension, okay, most of the factors are there. So atherosclerosis itself can result in gangrene. Peripheral arterial disease like vasculitis, like Burzer's disease, we have studied that before. Burzer's disease, also known as thromboangiitis obliterans, which is associated with smoking, is one of the perfect example of peripheral arterial disease. Embolization, okay, thrombosis of the artery, these all can lead to gangrene. There is one special term which is known as Raynaud phenomena. This Raynaud phenomena is associated with, okay, it is associated with connective tissue disorder, where there is classically a 3-color change occurring in a particular tissue which is exposed outside, and this color change mainly caused by cold exposure, okay, cold exposure. And this color change, in the beginning it will become pale, then it will become blue, at the end it will become red. So pale, blue and red, this color change, okay, uh, is called Raynaud's phenomena. There is another term which is known as Raynaud disease. Now Raynaud disease means these color change are occurring there without any explanation, means without any underlying diseases in the body, okay, or some sort of idiopathic type of condition, you can say, that's called Raynaud disease. But Raynaud phenomena usually occur along with connective tissue disorder. Now let's go and talk about the two main types of gangrene. These are dry gangrene and wet gangrene. Now let's differentiate them. It's an important question for any exam. Dry gangrene looks very dry, okay, dry gangrene looks very dry. This is the first thing. Please mute yourself. It looks very dry, and there is a clear cut, a line of demarcation between the healthy tissue and the dead tissue. That line of demarcation is an important point in dry gangrene. This can be seen very easily if the patient comes to you with dry gangrene. Okay. Now the causes are the same one which we just discussed. It can be caused by diabetes, it can be caused by atherosclerosis, it can be caused by some autoimmune diseases, okay, which cause Raynaud phenomena and things like that. So dry gangrene is not a very scary type of thing in comparison to the wet gangrene, because wet gangrene can, okay, wet gangrene can spread from one area to the other, whereas dry gangrene will be localized to that place, because there is a clear-cut line of demarcation between dry gangrene and the wet gangrene. So these are the very important points. Now what about wet gangrene? Just remember one point here. If infection is associated with any gangrenous area, this is called wet gangrene. So there is some exudation, there is some pus, there is some infective material, and that area look wet. It is no more dry. This is called wet gangrene. So the causes are still the same. If they are associated with infection, we can call that wet gangrene. One more concept in wet gangrene is, if some tissues are, okay, getting dead very rapidly or quickly, and if they are associated with some crushing or squeezing type of injury, then there is a chance of development of wet gangrene. And in comparison to the dry gangrene, wet gangrene is very complicated because it can spread to the normal tissues very quickly, and it can be life-threatening illness as well. Now let's see some of the picture here. Okay, please focus. So this is a dry gangrene. This is a dry gangrene. It doesn't look wet. Okay, I cannot see any fluid there or any discharge from there. Okay, it's here. This is wet, especially, still in the picture we cannot see any type of discharge, but it is written as a wet here, so we believe there is some exudation or some liquid or discharge coming from the gangrenous site. And this is called gas gangrene. Look at the bulla or the bleb formed. Gas gangrene is all about formation of the gases in that tissue. Okay, it is caused by one of the organism which is known as Clostridium perfringens. So dry gangrene and wet gangrene. Gas gangrene is a type of wet gangrene. Now see here. Look at this picture, all of you. Look at this area. It is black in color, and I can see it looks like a wet type of gangrene. Okay, a little bit of exudation is coming from here. It is clearly written the diagnosis. This is diabetic gangrene. So probably this patient is a diabetic patient, and this is a complication of diabetes. Gangrene is very common in diabetic individuals. Now another picture. Okay, uh, it is also a diabetic patient, and a gangrene has developed here. Okay, this is a very alarming type of presentation. Look at this. Okay, the great toe along with all other toes are gangrenous, and even it has spread. Even it has spread to the other areas of the foot. Okay, so only treatment in this condition is amputation. Amputation is cutting off that area which is gangrenous. This person probably has neglected the disease for a long time. Okay, in the beginning uh, there is lack of the blood supply, and that can be diagnosed with the loss of pulse there. So I am going to ask you a question here. Which pulse we palpate in the foot area so that we know there is lack of blood supply? Which are those two pulses? I want the name here in this area.
Dorsal spadius, sir, and posterior tibial artery.
Posterior meniscus near
The dorsal spadius and the posterior tibial. So the dorsal spadius and the posterior tibial.
Very good. Abbas, Uzair, and other students are also answering. Very nice. Absolutely correct. So these are the two pulses in the foot area. Dorsalis pedis, also known as arteria dorsalis pedis, and posterior tibial. So always palpate these pulses during your cardiovascular system examination. If they are nicely palpable, then there is a good amount of blood flow in the foot area. If it is not palpated properly, okay, then we are in trouble. That means there is a decreased blood supply which can result in gangrene later on. Let's move on. Now look at this picture for a moment. All of you please focus here. Now this is called Fournier's gangrene. Okay, Fournier's gangrene. Now this is a very severe type of gangrenous change which occurs on scrotum. This is scrotal gangrene. See this, the skin is sloughed off, okay, because of the gangrenous change, and testicles are visible from outside. Okay, even the root of the penis is suffering from it. Even the shaft of the penis is suffering. This is Fournier's gangrene, and this is mainly associated with infection. Okay, infection. Polymicrobial infections are mainly responsible for Fournier's gangrene. This is a very severe type of gangrene. Now another one, now see here, this looks like a dry type of gangrene to me. Dry gangrene, because it looks quite dry. I cannot see any exudation or any discharge from the gangrenous site. Okay, and see, this is called line of demarcation. I can clearly see here. Let me show you with the help of pointer here. See this. Okay, this is called line of demarcation, this area. So this is a hallmark of dry gangrene. Now what are the symptoms of gangrene? Okay, what are the symptoms of gangrene? Let's talk about it. We are talking about the general discussion of gangrene first. Okay, after that then only we will move on to the gas gangrene. Now we may notice this type of complaint here: dry and shriveled skin that changes color from blue to black and eventually sloughs off. So in the beginning the skin is healthy, so slowly there is a color change in that skin. Okay, always in the beginning there is blue discoloration. When there is a decreased blood flow, then ultimately when it is completely cut off, the color will become black. And in case of a severe type of gangrene, and because of some putrefactive changes or secondary changes, we may lose that area. That is called slough off, sloughing of that area. Sometimes there is spontaneous loss of the fingers and toes because of the gangrene. In the very beginning, okay, the person cannot feel any sensation there. The person may feel it's a numb and cold area. This is again because of lack of blood supply. Okay, because of the lack of blood supply, the person cannot feel any sensation there. Sometimes pain may be there. This is called ischemic pain. Ischemic pain may be a feature of gangrenous changes quite early. When the area is completely dead, there may not be any pain because everything is dead at that site, But during the process, in the beginning, there may be pain. So these are the common symptoms. What about the wet gangrene now? What symptoms can you see? That there is the color change. Okay, color change may be similar. Blisters or sore that produce a bad, foul smelling, okay, discharge is a hallmark of wet gangrene. So there is a blister formation or some ulceration, blister formation or some ulceration. See there, okay, which produce some type of discharge, and that discharge is very, very foul smelling. Sometimes a frank pus may be there. If this is spreading to the normal area, then fever may be there, and the person is feeling unwell because this is a very serious type of condition going on in the body. Because of the rapidly spreading nature, okay, it can quickly develop into septicemia, septic shock, and death of the patient. So we need to be very careful here. If I palpate that area with a gloved hand, then a crackling noise, okay, a crackling noise may be coming from there. Now, anybody tell me what is this crackling noise because of?
It's also called crepitations, like when we press at one side, then it produces some sound like breaking something.
Okay, okay, good. Any other answer? Okay, now see there, this crackling noise is also known as crepitation like noise, and this is because of collection of gas in that area. This is because of collection of gas on that area, because probably because of the infection, because of the bacteria. These bacteria are decomposing substances there. Some of the gases will be formed, and these gases present inside the tissues, when we palpate that, will produce a crackling type of noise or crepitus type of noise. This is one of the important features of wet type gangrene. Now how we treat the gangrene? Okay, let's talk about the general concept, and then we move on to the specific one. Now see here. Now one of the important treatment of gangrene is surgery. So you remove, after that area is gangrenous, there is no other way but you remove that area. Okay, this is called amputation. Let me write the term for you. This is called amputation. This amputation is a detachment of that site from the healthy area. So the surgeon will have a tough time to find out what is the boundary between unhealthy tissue and the healthy tissue. Sometimes we need to go a little bit higher, okay, a little bit higher than the gangrenous area, so that a large area need to be sacrificed. So what I am telling here is sometimes a 5 centimeter, okay, distance, okay, is marked, and they will cut there so that that area would be amputated. So this is called amputation, one of the very, very important treatment when a gangrenous change has already happened. But in the beginning, okay, in the beginning, if it is not completely dead, it is in the process of gangrenous change, then we can do debridement. We can remove all those dead and devitalized tissue, okay, and if we maintain the blood supply there along with some antibiotics, along with some hyperbaric oxygen therapy and some maggot therapy, then the tissue can be prevented or protected. Okay, so this is the one. Now see here. Okay, let me accept some of the students. Okay, now see there, the part 2 management of a gangrenous area. There is a special type of therapy known as maggot therapy. Now these maggot are the larvae of the fly, okay, the house fly, the common fly. They are the larvae of the fly. Now these maggots, okay, now what is the use of these maggot there? Now see here, these provide a non-surgical way to remove the dead tissue. So when we put these maggot on that gangrenous area, they consume the dead and infected tissue without harming the healthy tissue. So that's the special characteristics of those maggot or those fly. They only eat those dead and infected tissue, and they don't do any damage or harm to the healthy tissue. That is first thing. Second, they also help fight infection and speed up the healing process by releasing some substance which are bactericidal. Okay, so they release certain bactericidal substances, so they can kill the bacteria, so the healing mechanism is speed up. So these are two important effect of maggot therapy. So this type of treatment are also employed. But let me tell you one thing, after the complete gangrenous change has already occurred, probably this type of therapy are no useful. They should be done when the tissue is still surviving, that still there is a scope or hope of saving that part. Antibiotics always play a big role, especially in wet type of gangrene. We have to give a good dose of antibiotic from IV route. Now another type of therapy which I already mentioned is a hyperbaric oxygen therapy. Hyperbaric oxygen therapy. Now hyperbaric means oxygen is given under pressure. Okay, hyperbaric, under increased pressure. That means the oxygen is driven into the tissue. So what is the principle of using this type of therapy? Now remember, these are dead and devitalized area, so there is a very high chance of anaerobic infection there. So these anaerobic bacteria are killed by oxygen therapy. So this is the whole principle behind this. Okay, another so these are again should be done when the process is going on. When it is completely happened already, probably they are of no useful. See there, this is the hyperbaric oxygen chamber. Okay, hyperbaric oxygen chamber. So like that we can treat the patient. So with this background information, okay, this is a good time we enter into our topic proper, that is gas gangrene. Now see here. Now this gas gangrene is caused by a bacteria, and this bacteria belongs to Clostridia family. Okay, the name of that bacteria is Clostridium perfringens, also known as Clostridium wellsii. Okay, wellsii or perfringens is the same thing. In some of the textbook it is written as wellsii and some perfringens, but perfringens is more commonly used term. Now can anybody tell me, is there any other infection or problem caused by Clostridium perfringens apart from gas gangrene? Any other?
Yes, sir. Clostridium perfringens also cause food poisoning.
Excellent, excellent, very good. It also causes food poisoning. See, this type of questions are very commonly asked to you. Okay, so please everybody remember that it also causes food poisoning, not only gas gangrene. So gas gangrene is a type of wet gangrene. There's no doubt about it because it is caused by infection. So it is a wet type of gangrene resulting from Clostridium perfringens infection. Now, just like Clostridium tetani, these Clostridium perfringens are also gram-positive bacilli, which are spore-forming, and these are anaerobe. These are anaerobe. They can be killed by exposure to oxygen. These are gram-positive, spore-forming, non-motile type of bacilli. See here, these are important points, so let me underline them. Spore-forming, okay, and they are anaerobic. Now, they are rare in civilian practice, but they are common in battlefield injury, especially the gunshot injury. Okay, the gunshot injury or the bullet injury, they are commonly associated with Clostridium perfringens infection. The usual site for infection is a dirty wound which has been closed without adequate debridement. Now, a bit similar to Clostridium tetani here. So dirty wound is a necessary point there, and sometimes what we do, there is a cut, okay, there is a laceration, for example. Now something is still there deeper inside the wound, but we have failed to remove it completely. We have failed to debride the wound cleanly, and then without that we have closed the wound with suture. This is a very, very important point in the development of gas gangrene. The toxins which are produced by these organisms, they destroy the cell wall and they rapidly lead to tissue necrosis. Okay? They rapidly lead to tissue necrosis. See here, tissue necrosis, thus producing disease spread. Later on, we'll talk about what are those different toxins, what are those different, virulent factor produced by this particular organism. One of the important virulent factor is called lecithinase. Okay, lecithinase. That lecithinase will destroy the lecithin part of the connective tissue substance. So that is also known as spreading factor for gas gangrene. Okay, we'll talk about that later on. This is the introductory slide. The other Clostridia can also cause gas gangrene, but they are very less common. They are Clostridium novi and Clostridium septicum. Okay, even if you don't remember this name, okay, nobody who will be bothered, but please remember Clostridium perfringens or Welchii. Let's move on. Now let's see what are the characteristic points of this bacteria, Clostridium perfringens. See here, they are the large gram-positive spore-forming bacilli. Okay, see here, large gram-positive spore-forming bacilli or rod, and they are non-motile. And this spore, okay, is one of the form of this bacilli. We already know. Okay, when the environment is tough, when they had to fight for the survival, okay, they change themselves into a spore form. And when the environment is favorable for them, okay, they germinate again into the vegetative form. So they switch between the spore form and vegetative form. These are anaerobic type of organism. Okay, so they form stormy fermentation in milk media. This is how we can identify them later on in microbiology lab. There is double zone of beta hemolysis. Okay, beta hemolysis is a very clear hemolysis around. Okay, there are three different types of hemolysis: beta, alpha, and gamma. Beta is a very clear type of hemolytic zone around, and one of the very important virulent factor which they produce is called alpha toxin, which is also known as lecithinase toxin, different name, also called as phospholipase C or lecithinase. It is considered as a spreading factor in case of Clostridium perfringens or gas gangrene. Now you can see, okay, these are the gram-positive organisms. See there, gram-positive bacilli looks like this, purple colored. Okay, purple colored gram-positive organism. They are rod-shaped. That's why they are called bacilli. The reservoir of Clostridium perfringens are soil and human colon. Even in human colon, they are present. But they do not usually cause any disease there. Now, let's talk about the pathogenesis of gas gangrene. Regarding the pathogenesis, we need to know certain toxins which are produced by Clostridium welchii or Clostridium perfringens. The alpha toxin is the commonest and the most important one. Others are beta, epsilon, iota, phi toxin, and kappa toxin, the different names. Okay, but please, even if you forget all these, it doesn't matter. Do not forget alpha toxin, because this is one of the most important regarding pathogenesis. These are just the other names. Now there are various strains of Clostridium perfringens. Okay, they from A, B, C, D, and E, or you can say from A to E. Among them, the A strain is the commonest one. Okay, the A strain is the commonest one. Now, the one small point you need to note here: non-clostridial gas-producing organisms like coliform can also cause gas gangrene. So let me explain this by giving you one example here. If one area, okay, in a patient's body is having some gangrenous change, not only this Clostridium perfringens may be responsible there, but at the same time other polymicrobial organisms may also be there. It is called polymicrobial, means multiple type of bacteria may be there, and many of them can produce gas from the dead tissue. I'll give you one other case scenario to understand this point. After a person is dead, okay, and if that dead person's body is neglected, nobody knew about it, okay, the dead body was lying in one area, okay, in an open environment, for example. Now after a few days, if we go and check that body, then there are multiple bleb or bulla formation on the surface of that body. Okay, this is because of the gas formation, and this gas can be formed by many different organisms, not only Clostridium perfringens. Now these are the different exotoxins which are produced by Clostridium perfringens. Now in today's morning class, okay, I asked the students to differentiate between exotoxin and endotoxin, and many of the answers were correct during the class. Now see there, these are the exotoxins, means they are produced by the living type of bacteria, okay, and in this case this is a gram-positive bacteria, so definitely it is producing exotoxin, there is no doubt about it, and it can be absorbed in the blood and it can cause a lot of damage by reaching different tissue. So let's analyze this now. One of the important is lecithinase, we already talked about. This is a very important toxin which is hemolytic, membranolytic, and necrotic. It can cause extensive myositis and damage of the muscle. So it is hemolytic, means it can break the RBC. Membranolytic, it can break, okay, the cell membrane of different cells, and it can also damage muscles. Hemolysin is a separate type of toxin, okay, which can cause extensive hemolysis. Hyaluronidase helps in rapid spread of the gas gangrene. This, just analyze this. Hyaluronidase, it breaks the hyaluronic acid, and that hyaluronic acid is a part of our connective tissue substance. Okay, so hyaluronidase will break hyaluronic acid, which helps in rapid spread of the gas in that surrounding area, and proteinase will break down the protein in an infected tissue. So in one sentence, we can wrap this up like this: not only alpha toxin or lecithinase, so many other additional toxins are also produced by Clostridium perfringens, and they can help in the pathogenesis of the disease. Now, okay, let's move further. So let's talk about the real mechanism, how the disease occur after knowing all these different toxins. So in the beginning, there is a very bad injury or trauma. After that, the spores enter through the devitalized tissue. Okay, these are the different modality of damage or injury. RTA is road traffic accident, cross injury or battlefield injury. These are the modality of damage or injury in that area. And if it is contaminated very badly, then the spores of Clostridium perfringens will enter into that area. That's the first thing. The second thing, these are spore forming organism. So those spore forming organism will change into a vegetative form. Okay, means they germinate into the active form or vegetative form of the bacteria. Now these bacteria will multiply or proliferate there. Okay, they become in the large number, and then the exotoxins are released, which leads to their effect. A bit similar to Clostridium tetani pathogenesis, similar type of mechanism. Now, what these toxins are doing there? There is extensive necrosis of the muscle, okay, with production of a lot of gases there, and the constituents of those gases are hydrogen sulfide, nitrogen, and carbon dioxide. Also, hydrogen sulfide is a very important one there, and these gases will stain that muscle or tissue brown or black in color as well. The whole muscles is involved from origin to insertion. Probably it starts from the belly of the muscle. Belly means the middle part, and it may go toward the origin or insertion. It often may extend into the thoracic and abdominal muscles as well, but usually starts from the limb muscle. And if liver is affected, we call that foaming liver because of the formation of some frothy blood with necrotic tissue. This is called foaming liver, which is a characteristic point in gas gangrene. Now let's move further. Let's talk about some other important point regarding this spore forming organism. They germinate into the vegetative form. They germinate into the vegetative form under anaerobic condition. Please mute yourself. So they germinate into vegetative form under anaerobic condition. This anaerobic condition means if the tissue is dead and devitalized. That's the important point. Okay, now let's move on. So these vegetative cells, after that, they produce those toxins. Alpha toxin, okay, is the most important one. So many times I've repeated. There is hemolysin also. Okay, there are some other types of toxin as well, and that toxin disrupt different cell membrane. Okay, so lecithin is a part of phospholipid, and we all know phospholipids are present in all cell membrane. So it can damage any cell membrane of any cells or tissues. So it can damage RBC, it can damage platelets, WBC, endothelial cells, muscle tissue, okay, so many different ones, resulting in hemolysis, tissue destruction, and even hepatotoxicity. These are the common, manifestations of gas gangrene. One of the very important point, though we can, discuss this again during the investigation, but it is the function of alpha toxin. That's why it is highlighted here. That is called Nagler's reaction. Now, this Nagler's reaction is the study of alpha toxin function. This alpha toxin is a lecithinase, so it will completely destroy the phospholipid whatever is present there, or lecithin whatever is present there. So see here, so how we do this Nagler's reaction test? It is done in an egg yolk agar plate. On one side of that egg yolk agar plate, we put anti-alpha toxin. We put anti-alpha toxin. Then on the other side, we don't put any anti-alpha toxins. So that's how we can compare the effect of this toxin. Then we inoculate this particular bacteria, this particular bacteria called Clostridium perfringens. Then we check what is the lecithinase activity on that egg yolk agar plate. Now let me explain this with the help of a picture here. See this? So all of you please focus here. You can clearly see, look at the color here on this side, on this side it looks quite clear. So this is because of the lecithinase activity which is secreted or produced by that particular bacteria. So naturally on this side we do not put any anti-alpha toxin. If we put anti-alpha toxin, that will neutralize the effect of lecithin, and we don't see anything here. So we don't put anti-alpha toxin on this side, but on this side, see there is the effect of lecithin. So we don't see the effect of lecithin. I'm sorry, we don't see the effect of lecithin here because we have kept anti-alpha toxin on this side. So to make it a bit clear to you, so let me write it here. See this on this side, on this side anti-alpha. So let me take it a little bit up. Anti-alpha toxin is kept on this side, but on this side, on this side here, no anti-alpha toxin, no anti-alpha toxin. So what is the point now? On both side we have kept, on both side we have added or kept the bacteria. So because of no anti-alpha toxin here, the lecithinase activity can be seen very nicely. So this is called lecithinase activity. So let me show it once again here. Here is the lecithinase activity. Now after that there will be no confusion. Lecithinase activity, where there is no anti-alpha toxin, but on the other side the lecithinase activity cannot be seen because anti-alpha toxin is kept here, which will neutralize that lecithin. So this is called Nagler's reaction. Let's move on. Okay, now let's summarize these pathogenetic point with the help of one slide. So please focus here, focus on your slide for a few seconds, then let me explain this. Now let's start from the wound area. See here, this is the wound area. This is a very bad looking type of wound which is probably contaminated with soil, and that acts as a source of Clostridium perfringens. Now the spores have entered inside the wound, because of the favorable environment, and that favorable environment means the area has to be hypoxic or ischemic. The spores will germinate. Now, after the germination, the vegetative cells would come out and they'll start to multiply or proliferate. Okay. Now, these some of the vegetative cells will again develop into the some of the spores form. Okay, so they keep on germinating, developing into the vegetative forms and like that. So don't get confused here. So after that, there is fermentation of the carbohydrate. That is a special, function of these, organism. Formation of the gases. Okay, like hydrogen sulfide, carbon dioxide, and nitrogen. These are the main gases there. After that, the collection of the gases inside the tissue will distend those tissue. So if it is inside the muscle, okay, the swelling of the muscle. If it is a subcutaneous tissue, there is a collection of the gases there, and when we palpate or feel that area, it feels like there is a crackling sensation or there is a crepitus like feeling. Okay, so all these things will further interfere the blood supply in that region. Now remember, I think I've explained this mechanism before. If a region or a organ or tissue is infected, okay, because of the increased pressure development there is interference in the blood supply, which can result in ischemia, and this area is already dead because of all these mechanisms. It will further aggravate the process. Okay, at the same time, it can spread to some nearby healthy area, and the disease will be spreading, resulting in toxemia. Toxemia means sepsis, and it can result in death of the patient if it is not controlled in time. So this is all about the pathogenesis of gas gangrene. And look at the incubation period. It may be variable from 1 to 7 days. It can be so short as 24 hours to up to 7 days. Now let's move on. Now this slide is trying to show us if there is atherosclerosis, if the person is diabetic, or if the person is having colon cancer, which occurs inside the colon, of course. These patients are having high chance of developing gas gangrene because there is already some predisposing factor there. Now this is the picture of the presentation. Look at this area. There's a crepitation in the tissue. We cannot see this crepitation. Okay, it can only be felt. Okay, you have to palpate there with a Dunning globe. You have to feel those area. If a crackling sensation is felt, then okay, these are called gaseous collection. Foul smelling discharge is very common because this is a wet type of gangrene. There's a rapidly progressing necrosis, which is progressing to the proximal part. Hemolysis, fever, sepsis. Okay, if that sepsis is a very advanced one, it can result in septic shock also. The shock which is developed in these conditions is always septic shock. And septic shock is a type of distributive shock. Okay, the blood pressure is quite low. At the same time, renal failure can occur, and all these combined together can lead to death of the patient. Okay, so let me tell you one thing here. This is a very serious condition to have in the patient. If diagnosis and treatment is delayed, the patient can die. Now let's see some other pictures here. This is gas gangrene in the upper limb. This picture is showing gas gangrene in the upper limb. Okay, see there, it is after the effect of an assault using an axe by a drunkard husband. So there is a attack, okay, by the husband, the wife, and probably this type of a disease has happened. Another one, this is very bad or very advanced type of appearance, gas gangrene involving the entire leg very extensively. Now, after this, it is very easy for us to talk about the clinical features. All of you, please focus here. Okay. Now, one thing I like to highlight here, if you know the pathogenesis, okay, well, the clinical features are very easy to understand. See here. The clinical feature appear as early as 24 hours of the injury, okay, 1 to 7 days. So 24 hours of the injury, it's very early in some of the patient. The patient become rapidly and profoundly septic as those exotoxins leads to rapidly spreading muscle necrosis with overlying skin discoloration, edema, and crepitus. This is the most important clinical feature. There is rapid death of the muscle. The skin gets discolored, that is black in color. It is edematous, and there is a collection of gas, which is known as crepitus filling. Even with urgent wide surgical excision of all necrotic tissue and high dose of antibiotic, that is penicillin, as well as metronidazole, the disease still carries a high mortality rate. See there, and that's why it is considered a very serious illness. Even with good management, there is a high mortality rate. And this is a good type of management the doctor have done. Wide surgical excision of all those necrotic tissue with a good dose of antibiotic. But why the patient die? Probably already the septicemia has occurred. Already the septic shock has occurred in the patient. So it carries high mortality. There is a foul smelling serous exudate and the bleb or blister formation, and these blisters contain mainly the gas, and sometimes some discolored fluid can also be there. This is very foul smelling type of discharge. Jaundice can be seen in the patient if liver is affected. That means the infection has already spread till the liver. So this is considered as a very ominous sign. Ominous sign means it is already very advanced type of stage. And oliguria, now every student know, oliguria means decreased urination. So decreased urination occurs in renal failure. Again, another feature of septicemia. Clostridium perfringens or Clostridium welsii can infect limbs, abdominal wall, appendix, see there, gallbladder area, common bile duct, intestine, and even the uterus during septic type of abortion. Now, septic abortion may be a new term for you. Now, septic abortion means if some healthcare worker, if they induce abortion surgically without proper sterilized equipment, then the infection may enter into the uterine cavity. This is known as septic abortion. And during this time, one of the infection which is there is gas gangrene. It can kill that lady. So not only the limbs, but so many other organs are also affected by gas gangrene. Let's move on. Now, what are the investigation we like to do in this disease? Now see there, just like in Clostridium tetani infection or in tetanus, that was a purely clinical type of diagnosis. In these conditions also, the most important way of diagnosing is a clinical diagnosis, but we can do certain type of investigation to make sure is that gas forming organism is Clostridium perfringens or something else. Because what I said few slides before, not always those gases are formed by Clostridium perfringens. Sometimes they are formed by some other microbial agent also. So some of the lab test has to be done here. Now let's come to the slide. The clinician is largely influenced by the clinical features of rapid advancement of severe gangrene, which involve the muscle. And treatment is the priority here. Diagnosis is very easy. That's what they are saying. So treatment is the priority. Don't delay your treatment by giving different excuses. Oh, I don't know what is a causative agent here. So let me find out that first and then only I'll start the treatment. Nothing like that. This is a very lethal infection. As soon as you suspect the disease, start your therapy. Wound fluid may be rapidly stained and inspected for large gram-positive rod. See, this is gram stain. Okay, we can go for gram staining, and if gram staining is done from the fluid which is oozing outside, we can detect gram-positive bacteria there, and probably they are Clostridium perfringens. We can go for culture and sensitivity test just to make sure which antibiotics are working for them. Okay, we can detect this storming type of fermentation. Okay, again in the culture media, usually the milk type of media are used here, and lecithinase test. Okay, lecithinase test in the egg yolk media, we already talked about that. So these are some of the important investigation. Now some more type of investigation would be X-ray of that particular area. Now remember, there is a formation of gas in this condition, and gases can be easily seen in X-ray. Okay, some black type of discolored area are seen in X-ray regarding the gases. So we can see those inside the muscle plane or under the skin. This is one of the important type of test here. We can make sure that yes, there is formation of the gas. If liver is affected, if kidneys are affected, then liver function test, renal function test, okay, total count to make sure whether there is sepsis or not, and arterial blood gas is also necessary if you think this patient is in septic shock or patient is terminally sick. These are different types of tests we can do. It all depends, which organs are affected here. So let's do this, because this disease commonly causes septicemia, and after septicemia different organs are affected. So it is not a bad idea to do this type of investigation. Now one small point I like to highlight here: in your exam, especially in the viva or oral exam, your teacher would love to ask you why you want to do this particular investigation. You need to give reasons. Okay, don't only list the name of the investigation there. That's not the answer we expect. You have to know why this test is done. So in this disease, in this condition, if I ask that question, you can easily answer now. Because of septicemia or sepsis, multiple organs can be affected. So just to make sure whether they are normally functioning or not, we want to do this different investigation. Now, CT scan of the part may be useful, especially in chest or abdominal wound. Okay, just to make sure whether it is spreading there or not. Now we have come towards the end part of this lecture, that is prevention and treatment. Now prevention or preventive part is very important here, because once this disease occur, probably treatment is very difficult. Okay, there is high chance of mortality, so we focus on the preventive aspect. Do a thorough wound toileting. Okay, thorough wound toileting means extensive wound toileting or debridement is done. Okay, if it is a bad looking type of wound, and that is done by hydrogen peroxide or normal saline. This hydrogen peroxide, okay, is a type of antiseptic solution, and normal saline, okay, we flush that area with normal saline. Even with tap water, it can be done in the beginning. So extensive wound toileting must be done. In high risk wound, okay, in high risk wound, we have to give penicillin or tetracycline, but penicillins are preferred. They are given in high dose, that is 1.5 mega unit for hourly. Okay, 1.5 mega unit for hourly. So this is a high dose of penicillin. Isolate the patient from other surgical patients. Okay, because that Clostridium perfringens, okay, that may contaminate other surfaces there, and somehow if it is reaching other terminally ill patient, and if they are having some favorable environment inside them, then they can also have similar type of problem. Now have a look at this picture. This is called amputation. You see this? This is the stump. Probably the distal area is cut from the body and they are closing this stump. This is amputation. Now this amputation may be necessary to do in this type of disease. I'll give you one scenario here. A patient has come to our hospital with extensive type of gangrene of the lower limb. Till now the affection is below the knee. Okay, till now it is below the knee. So if we amputate that part, if we remove that part, okay, below the knee, then probably we can save the life of this patient. So amputation is definitely one of the options. You see there, amputate under a tourniquet and close the stump by delayed primary suture. Okay, now tourniquet is a ligature there, so that whatever toxins is released in that area would not be absorbed, okay, in the proximal site. This is the mechanism for tourniquet application. And delayed primary suture means do not close that wound right now. Okay, give some time, give for the antibiotics to work, probably antitoxins to work, and close it later on. So this is called delayed primary suture. Now at the end, let's talk about what is the treatment options, or what are the treatment options which we have in the management of gas gangrene. Now before I go into this slide, okay, I want all of you to listen to the discussion first. Now this is anaerobic type of organism. This is the first point. So this is a type of bacteria. Second point. So we need to give antibiotic. Okay, this is the first thing. And we need to give hyperbaric oxygen therapy. Now remember, we talked about this before also. If we provide oxygen under pressure in that local area where these gas gangrene changes are going on, probably we can kill this bacteria. Okay, this is the second thing. Third one, this bacteria is producing few important toxins. One of the important one is lecithinase toxin. So if we give antitoxin to the patient, it is very, very helpful in the treatment of this condition. Okay, this is the third important point. The fourth one, if we cannot save that limb or that part of the body, especially the limbs, we have to sacrifice it by going for amputation. This is the fourth option. And the fifth is some symptomatic and supportive therapy. If the person is already having a septic shock or septicemia, okay, then go for the necessary management for that. So if you think like that, the important point are not missed. Okay, now let's focus on the slide. The key event in the treatment of this condition is early diagnosis. Definitely, there is no argument here. Early diagnosis can save the life of the patient. Once the diagnosis is established, expert help should be consulted. Okay? Probably we need the help from infectious disease specialist here. Infectious disease specialist, because this is caused by infective organism known as Clostridium perfringens. Surgical treatment involves wide excision or amputation of the affected tissue. Okay. Now you already know the principle of this. In the beginning, if you think you can save that particular organ or part of the body, we go for wide excision, because I don't want to sacrifice the limb, because after doing amputation or sacrificing the limb, the quality of the life of that patient will be horrible, isn't it? So what our principles of surgery tells us, as far as possible, try to save the function of that part of the body as far as possible only. If that can compromise the life of the patient, don't go for that. Compromise the quality of life. Okay, and all the time your only focus is saving the life of the patient. So let me summarize this. If you have to choose the life of the patient and quality of the life, I'll definitely choose the life of the patient as the first option. Okay, so never forget this golden principle. The same thing is applicable here. Now, which antibiotics we are going to use? Penicillin only, metronidazole only, or combination of penicillin and metronidazole? Now, why the combination is used? Because this is a very serious type of organism, very rapidly spreading organisms. So sometimes the combination is used. Another important option is antitoxins. Now, these are known as anti-gas gangrene serum. Okay, antitoxin, and they are very widely used in wartime because there was a increased incidence of this type of infection during wartime. But in an ordinary patient, okay, who are having this type of disease in the hospital where we are taking care of this patient, it has a bit of doubtful value, but nevertheless it is one of the option which can be given in this type of patient. Now let me add something more here. In a desperate situation like this, we want to use every possible thing. Now these days we are suffering from pandemic of COVID-19, and there is no medicine for COVID-19, you all know that, but still we want to use, or we are using so many things. We are giving steroid like dexamethasone. Okay, we are giving antibiotic, we are giving oxygen, we are using ventilator therapy, we are giving different things. But why? Because we hope, or we believe even a little bit of effect by these things will help the patient. So same principle is applicable with antitoxin used in gas gangrene therapy. Now, what's the role of hyperbaric oxygen therapy? Okay, the main principle you already know. So let's talk about it now. To eradicate the required anaerobic environment there, if I provide oxygen in that tissue, the anaerobic environment will be gone. Presence of oxygen in the tissue will not allow that bacteria to multiply or proliferate. Okay, it may be effective in the treatment, and it requires very special apparatus. This is called hyperbaric oxygen chamber, which may be available in different hospitals. Now these are symptomatic and supportive therapy like rehydration and giving IV fluid, maintain good amount of urine output, maintain the electrolyte balance, and if hypotension is already there, okay, first of all we have to treat that hypotension with crystalloid, that is normal saline or lactated ringer. Give it this in a good amount, and later on you need to give the blood transfusion. So this is the management of hypotension. So let me clarify that once again, because this is a very important concept for you. Hypotension is decreased blood pressure in a case of gas gangrene. Now in the beginning we will give crystalloid to the patient. Now what are the example of crystalloid? Anybody? What are the example of crystalloids? See there, the crystalloids are normal saline, okay, normal saline and ringer.
Sodium lactate.
Exactly, ringer lactate. See there, let me write it for you. Ringer lactate. Okay, crystalloids are normal saline and ringer lactate. Never forget this. Exactly, never forget this principle here. In the beginning of the treatment of hypotension or decreased blood pressure or shock, always start with crystalloid. If it doesn't respond properly, then go for colloid. Blood is a type of colloid here. Now the last part of the discussion, is prognosis and prevention. Now look at here. If left untreated, gas gangrene is uniformly fatal. It will lead to death of the patient. Okay. If left untreated, it will probably cause 100% of the death. We cannot prevent any patient. We cannot protect them. But even after good type of management, even after aggressive type of intervention or treatment, the mortality rate may remain as high as 40%. That's why it is considered one of the lethal infection or very severe infection. So early diagnosis is very, very important, and many of the time high index of suspicion is necessary. That means if it is suspected, we start the therapy. We don't wait. We don't wait for the confirmation. Now, regarding the prevention, if there are deep penetrating wound in the muscular tissue, okay, these are the prime site for the development of gas gangrene, especially if they are contaminated. So what should we do? We should explore them. We should debride them. We should remove all the dead tissue from that area with the good excision. And if the slightest amount of doubt is still there, you go for the proper therapy and don't close the wound. You keep that wound open. Okay. If necessary, we can go for delayed primary suture later on if nothing happens or if no infection occurs in that wound. So these are the important steps for prevention. Now, look at this. This can be utilized as a take-home messages. Okay, take-home messages here. Once a ward or operation theater is used for a patient with gas gangrene, it should be fumigated for 24 to 48 hours properly to prevent the risk of spread of infection to other patients, especially with open wound. Now, we will work in hospital later on, okay, after passing our licensing exam, okay, and this is a very, very important point we should never forget. So once we take care of this type of patient inside the ward or in the operation theater, we should fumigate. Fumigate is a mechanism of sterilization there. Okay, so fumigation must be done so that it doesn't spread to other people who are having open wound there or who are having favorable environment. Okay, this slide you can do on your own. Okay, basically we have completed the discussion on this topic, and this is, see there, different types of infections here. Okay, and what are the important antimicrobials we need to choose. Now I will directly go for the gas gangrene. Now see there, see this area, amputations and gas gangrene. Look at the microbials here, antimicrobials, benzyl penicillin with metronidazole. Okay, the combination of these together. And if septicemia and septic shock, we can go for amoxicillin, metronidazole, and 1 gram negative like gentamicin or amikacin. And if you believe a multi or polymicrobial organism, you can go for other broad spectrum antibiotic.